I'm going to start walking through the presentation, and what I'm going to probably do, unless people start calling in or emailing in, is I'm going to move rather swiftly through the background information on the context in Tanzania and some of the global literature, because I think you're probably familiar with a lot of that, and then try to reserve as much time as possible for discussion about programming strategies. So I'm very eager to learn from all of your experience and for all of us to build together a sense of how to move forward strategically. So an outline just of what I'm going to go through today is what this effort was about and the framework for programming based on the evidence of girls' lives and the program approach that is evolving here in Tanzania, but also, very importantly, reflecting lessons learned globally, including from all of you who are working on girls' agency and girls' programs to build agency across HIV, unwanted pregnancy, and violence. So just a bit about the limitations or the caveats on what this effort was. It's a framework for program design across these range of issues, as mentioned, HIV, AIDS, unwanted pregnancy, and violence, specifically sexual violence. And it was meant purposely to address many different constituents in Tanzania. So implementers, programmers, policymakers, researchers, donors, NGOs, looking at opportunities for developing a coherent framework in the country since there isn't one yet in place. It wasn't by any means a kind of recipe for what to do or an evaluation of any program that currently exists. That was just beyond the ambit of what I was asked to do or could have done. So a framework for programming. What became very clear is that when we looked at HIV, AIDS, and unwanted pregnancy and violence together, that we were looking at girls' agency. Now, this is not going to be surprising for anybody on the call, and certainly even many people in Tanzania are moving in this direction, but we tried to make a very clear point that central to this was not any one of the three issues specifically, but the issue of and the capacity of a girl to decide and control what happens in her life, to be safe, and to pursue what she wants in life as she defines it. And if you focus on that framework of agency, you are in a better position to be able to address all three of these issues, either individually or certainly collectively. So when we look at girls' agency in this context of building resilience and reducing risk for girls, what we tried to do was to break out of 4 quadrants of major areas of both resilience and risk. Now, again, this framework for the resilience and risk will probably not look too different from other ones that you've seen or ones you've developed in your own programming, and you can certainly move across some of these quadrants, some of the particular issues, but this was an attempt to try and identify the major categories of programming around girls' needs, sexual relationships and the different issues within that, the social pressures they face, economic well-being and livelihoods, and then lastly is this issue of safety and protection. I put the word safety in quotation marks purposely because, at least in the context of UNICEF and perhaps some other institutions, safety has a particular meaning for programming. And there are particular professionals who come from a background working on children's safety. So I use this as a broad terminology for looking at reducing the risks that make girls unsafe in their homes and in their communities. It was important for us from the outset in this exercise to think about which girls we were talking about because, of course, girls are not a homogeneous group and they have very different needs. So we, from the outset, were talking about girls at greatest risk, facing the largest gaps, particularly in social connection, and who are least served. and we tried to keep a focus on that. I'll add in here, it'll come up a little bit later, but as part of this, we had a very long discussion in Tanzania about trying to reach youngest girls, so as early as 10 years old, which was pushing down the age frame considerably in Tanzania. So this is just some of the kind of highlights of the data from Tanzania around girls' risk, and I'll point this out because I'm sure in many of the countries in which you're living and working, there's going to be similar information. Education. What we have found in Tanzania, largely because the school fees have been eliminated, is that the numbers of girls and boys going to school is up tremendously. In fact, from about 59% in the year 2000 to almost 100% now. The problem is the outcomes, which are atrocious. The quality of education in Tanzania is appalling, and it has significant ramifications, very serious ramifications for girls and boys alike. Primary school outcomes is a deep concern in Tanzania in terms of keeping girls in school. CSEE performance is the graduation rates or the achievement rates at secondary level. The category, the division 4 and 0 to the right of the dotted line is essentially failure. And so only divisions 1, 2, and 3 can even be considered a pass in Tanzania. And you'll see that the rates of passing, again, looking at the quality of education, is dismal. Just moving quickly to the next slide around adolescent childbearing, which has gone down actually quite dramatically in Tanzania, although there has been an increase among 15-year-old girls and still considerable inequities around who is getting pregnant and the conditions in which those girls are living. Sexual intercourse and condom use, what we're finding is, if you look down at the note on the bottom, that about 3/4 of girls aged 15 to 17 report not having had sexual intercourse, which is a good thing. However, among those having intercourse in the past year, only about half used a condom, which is the bars on the right. I put this slide in on age mixing because in Tanzania there's an enormous amount of discussion around in the HIV community around girls having sex with men who are much older than them and the risks that pose, which of course is important. The problem is that we really don't have disaggregated data. So we know if girls are having sex with men 10 years older, but we don't know if they're having sex with men 5 years older, 6 years older, 7 years older, and that can make a very big difference in the life of a girl who is 13 or 14. We see in Tanzania, as would be true in many countries, the extraordinary risk that girls are facing and young women are facing in terms of HIV risk relative to boys and to men. And this is also just to point out that in terms of HIV rates among young women themselves, there is this extraordinary jump between ages 15 to 19 and 20 to 24, which is probably the strongest argument for putting programs in place for 10 to 15-year-old girls to try and head off this pathway of vulnerability that girls are on as they get older and older. This is to show that, thankfully, more girls and boys particularly girls, are finding out their HIV status as a result probably of the enormous amount of programming and media work and kind of general knowledge creation going on in Tanzania. Moving on to early marriage. This is looking at marriage and HIV rates, again showing the vulnerable position that girls who are married or young women who are married face in terms of HIV, the growing risks and the reason for having a new or renewed focus on girls who are married, who I think in many cases are kind of thought of as being safe because they're in marriage, but in fact can be extremely unsafe. This is some data from a study on early marriage being done by the Population Council in one region of Tanzania in Tabora, which is looking again at the question of early marriage, and it includes a conditional cash transfer to keep girls in school and unmarried. But if you look at the red line on that slide, among the girls who are married in this study, 41% had experienced at least one form of violence, including having their husbands beat them in the last 6 months. So this is, again, just to keep us focused on who are the most vulnerable girls, including girls who are married early. Social isolation and violence. I'm just going to put some slides here that you'll see. You can go back to them if you like, but a few slides trying to look at, these are regions of Tanzania, to identify what the Population Council often calls hotspots. So where in Tanzania are girls who are particularly vulnerable? For, in this case, girls who don't live with either parent, girls whose first sexual experience is forced. And I was actually just looking at a slide from Stride this morning where Lori and Charlotte pulled out data from the WHO study on Tanzania, and the rates from that study are much higher. And so I think this is also something we need to look at in Tanzania very carefully. Tanzania, through UNICEF, last year commissioned a huge study, very important study on violence against children, which is figuring very prominently now into programming in the country, which has been very good. The findings were extremely disturbing, including that half of girls and boys report being punched, kicked, or whipped by a teacher, and over 3/4 of girls and 2/3 of boys say this has happened more than 5 times, which of course raises questions about if we want girls to be in school, supposedly it keeps them safe and not destined for early marriage or early pregnancy or increased risk of HIV. We have to look at what's happening in schools as well. Next slide on transactional sex. I'm hoping that Joyce Wamoyi may be on the line. This is her research. Next slide. Transactional sex can be positive for girls despite the risks. This is some data that's coming out of her work, and she's a partner in Strive and is going to be looking at this question of transactional sex more closely in Tanzania and how transactional sex is a driver for HIV in Tanzania, and looking at issues of girls' economic livelihoods, alcohol, and gender-based violence. So this is just a summary of what I've gone through, and I'm not going to repeat it, but just to paint a picture of girls' vulnerability in Tanzania. What I'd like to do in the coming slides is just draw on some of the evidence that's coming out globally around girls' lives and to see how it feeds into our thinking about programming both in Tanzania but in the countries in which you're working as well, and we can learn from each other. The first thing is that what we have found, and I'm sure you've had this experience in many places as well, is that there's extremely limited rigorous evaluation or research on girls' lives and what works and doesn't work, leaving us with a lot of good intentions but many best guesses. And what a colleague of mine in Tanzania who works in the Ministry of Health on adolescent girls calls patchy efforts to try and reach girls. Here is some of the data, again, globally, on childbearing, HIV, and livelihoods among girls. The citations are down on the bottom in the small print, and I'm happy to send these around if that would be useful. There are some interesting pieces of data that are coming out. In particular, I just want to point out in terms of our thinking about programming how HIV education programs, generalized HIV education programs, may improve knowledge and attitudes and reduce pregnancy rates, but have very limited impact on behaviors and no impact on HIV rates. And this question of life skills or skills building that many of us kind of grapple with in our programming, it's a very loose definition, loose term, doesn't seem to be very well defined in terms of helping us figure out exactly what to do and what works. The data and evidence show that schools are generally a protective and promoting force for girls, although, as I said earlier, if we're finding that so many girls and boys are being punched and kicked and whipped by their teachers, it certainly raises very legitimate questions about how safe these schools are for girls. But we are finding that school attendance reduces risks of childbearing, HIV, marriage, and that as families see girls gaining particularly economic status and returns through education, they're more willing to invest to keep girls in school. I think this is linked to why lots of the cash transfers work, is conditional on girls staying in school. This is some of the information on cash transfers, which certainly has taken many people in a very compelling way around how to begin thinking in a kind of more innovative fashion around programming for girls. The evidence, however, is quite mixed. It seems highly promising, but it isn't so clear what works best and how. And this very important point around bullet number 3, that improving access to and utilization of services, be it either education or health, doesn't necessarily mean that girls' educational achievement or health outcomes is improving. And that's another piece that we need to be looking at. This is some data from the Zomba Malawi cash transfer, which, at least in this region of the world, people are looking at very closely and as a possibility for replication, or if not, as a complete randomized control trial, trying to pull out pieces of it. Again, the data is a bit mixed between the conditional cash transfer arm and the unconditional cash transfer arm, and for girls who were already in school at baseline and girls who were not. But there is some very promising findings coming out around reduction of HIV and herpes simplex rates. This is really important. By the same token, in that second bracket on sex and marriage, the third bullet, there were substantially higher pregnancy and marriage rates in the conditional cash transfer arm. So it's important that we continue to work with these cash transfers to find out what is keeping girls safe and what isn't. So I want to kind of leave the evidence from Tanzania and global evidence behind and move towards the program approach, and to use this as a way to focus our discussion as we move forward. Just a bit of background. The Tanzania AIDS Commission, or TAC-AIDS, had asked UNICEF to help them work on developing this approach, and UNICEF asked me to lead this process. And TAC-AIDS was very interested from the outset in looking at how can we do this at scale nationally, recognizing, however, that the work may have to be trialed in 2 districts or a few districts. But from the very beginning, they did not want just a kind of small boutique program that would only be operating in 1 or 2 places. So just to repeat some of the slides that came earlier, what we were focused on doing was building girls' agency across 4 core elements: norms, safety, economic security, and core social services, and reaching the girls most in need, which meant girls not in school. So in Tanzania, almost all girls at primary school age are in school. But as they get into secondary school, it very quickly drops off, and only about 30% of girls are in school. And as they progress through secondary school, the numbers kind of fall off a cliff. So these are those 4 core elements of building girls' agency, and what some of the programming elements might what might constitute. I'm going to leave norms, the upper left quadrant, to the side for the moment. Looking at safety and protection, what the programmatic experience globally seems to point to very importantly is safe spaces for girls. And there have been a number of programs internationally that have been working with this concept and reality and building on that as a platform for trying to protect girls. The core social services includes both access to and quality of care, as well as tracking and ensuring that girls really are getting those core services. Economic security is the area principally of savings, less so microcredit, because savings has shown to be a safer vehicle for trying to build girls' economic security. And then the 4th core element that came out of this consultative process was looking at norms, and particularly collective behavior change at the community level, often through media. And I found in my work on this, and I'm curious what everybody else has found, is this is the hardest to get a handle on. So in terms of designing a national program, but trialing or piloting in 2 districts, if you look down in the bottom circle, the smallest circle, the idea is a lesser focus on girls in school, biggest focus on girls out of school. The next circle around would be to combine at the district level programming between an NGO or set of NGOs and a local government authority. So you minimize the risks presented by either going with an NGO or relying on government, and you maximize on trying to find synergies and capitalizing on their strengths. The next piece of the framework that you'll see is an information platform. Next is piggybacking on current donor efforts. We happen to have a few in Tanzania looking at young people in various ways, but, I'm sure in every country there is. And then lastly, TACAIDS was concerned that there be a national coordination mechanism for the work we're doing. So let me just run through the specifics of this framework a little bit, and then we'll move towards questions and feedback. In terms of an NGO, there are, of course, many NGOs doing really great work, but I chose to focus on an NGO program of the Population Council in Ethiopia called Biru Tesfa, which is working at scale now across 18 cities of the country with out-of-school slum-dwelling girls. And the most vulnerable and disadvantaged girls in those communities, and trying to build social protection and service delivery for them. So I took the elements of the Biru Tesfa program and tried to fit them into the 4 quadrants that had been developed as part of this consultative process for Building Girls Agency. And so under each of the 4 orange titles of the quadrants, you'll see different aspects of the Biru Tesfa program that fit into that. And again, we could do this with a whole range of programs that are focusing on girls' agency, but this gives us a kind of structure to see whether or not there's balance across the quadrants, and whether, if you distill out the key aspects of the program, we're meeting each of the 4 objectives of Building Girls Agency. So this was a way to do it with Biru Tesfa. Just a few to point out. Under safety and protection, there is a strong emphasis on gender-based violence, and including trying to identify girls who are at particular risk of violence and getting them support and giving them life skills, and more recently reaching girls with disabilities. Many of the girls in the slums in Ethiopia are domestic workers, and they who have migrated to the cities and are hidden and at great risk of abuse. And this was an explicit way to try and reach those girls who are domestic workers. In the core social services, the girls are provided with a health voucher, so there is a linkage to local health services in the slum areas and in the cities, and a mentor. There are young women mentors who are a critical part of this program. They accompany girls for their health visits. The economic security piece is pretty straightforward in terms of savings groups and financial literacy. The girls are provided with ID cards as a way of both giving them the reality of personal identification and the security that comes from that, as well as giving them higher status in the community. This is, as I had said earlier in that concentric circle around NGOs and local government, this is an attempt to try and start laying out what would be the elements in each of the 4 quadrants that a local government could take on, like what in Tanzania we call the district authorities. And it's harder, as we all know, in many ways, but if we're going to be looking at sustainability and replicability, we have to figure out what are the elements of getting local government, wrapped into promoting girls' agency. If you look again at the safety and protection quadrant under child protection teams, this is something, if people are interested, I can send you more information or link you with colleagues at UNICEF. UNICEF is piloting in several districts around the country an integrated, multidisciplinary team of government workers, police, criminal justice, social workers, community development officers, judges, health workers, others, who are trying to identify and intervene with the most vulnerable children who are coming into or could be coming into conflict with the law. And one of the things that we're going to be working on is whether or not there's a way to get a particular focus on adolescent girls with that. So I don't want to spend time going through each one of these areas individually, but I think the biggest challenge that we're facing in Tanzania, and I'm eager to learn about from people who are on this call, is how to get this piece to work, how to engage with local government and get them to buy into a girls' agency agenda and to be realistic about what kind of programming we can do with local government. So for me, this is kind of the key slide. There's a lot of work going on internationally on information platforms in terms of mobile phone technology, social media, mass media, internet use, and this is basically to try and feature into building a framework the idea of how we can use information platforms to promote girls' agency. I don't know much about how it's done yet. I haven't seen a lot of examples, but I think this is something that we can be thinking about a lot more, and people who are much savvier than I am can advise us, or at least advise me on how to do this in Tanzania and in other places. These are some examples of very interesting information platforms around the world, and of course there are many, many others, that show us some insight into how information can get people engaged in issues and put information and accountability into the hands of local citizens. And I don't think it's out of question that we do this with young girls as well. This was the next concentric circle on that diagram, where we piggyback onto donor efforts. These are big kind of DFID, USAID, PEPFAR, other initiatives underway in Tanzania, highly donor-driven, but that provide a lot of money for programming nationally at scale, and in many cases either are or can be reaching girls, although they don't necessarily at the moment particularly have a focus on girls or the most vulnerable girls. So the idea then would be, how do we capture this money and this momentum to focus on girls in our countries? So this is now revisiting those concentric circles again, starting a minimal focus on in-school girls, starting in the bottom circle, focusing on out-of-school girls, looking at district programming that brings NGOs and local government together. On top of that, an information platform, piggybacking on donor efforts, and then looking at national coordination. The yellow or orange box there are two key national policy issues in Tanzania that we're hoping the national coordination can address. One is the return to school guidelines for girls who are pregnant and have been expelled or withdrawn from school because they were pregnant. And the second one is robust and real-life systems for handling cases of rape and abuse. This is just some programming principles to point out that I think we all grapple with: equity, transparency, measuring changes in how girls are actually living their lives, working at scale, not little tiny boutique programs, but moving things forward for massive numbers of girls, rigorous evaluation, which is currently lacking, and then broadly disseminating findings of what we learn and very importantly, what isn't working. I'll end there. Thank you very much.
Maggie, can I start off then with, what you've put in your last slide on rigorous evaluation? Because obviously, do you have any suggestions? Do you have any ways or know of any experiences that you can see it leads to promising ways of doing some more rigorous evaluation?
Yeah. Well, I have some ideas, and I welcome input from people who have a lot more experience with evaluation. I think the field of working with adolescent girls, or even sexual and reproductive health generally, is not unusual in the world of development and learning, where people are very squeamish about having their work evaluated, and donors are squeamish around putting in the money that's required to do it. And I think we've all suffered because of that, because we keep doing things that perhaps are making a difference, but we don't know if they really are. And so I think some of the key pieces of doing rigorous evaluation are that, number one, it has to be completely independent of the group that has both designed the intervention and implemented it, which is very rare. We all kind of write evaluation, midterm or final evaluations into our program work and, kind of find an evaluator who we kind of know or know very well and are not going to be threatened by and who isn't going to say anything too bad about what we're doing, and satisfies us and satisfies the donor, but doesn't often take the field forward. And, we've all done this. I've done this in my work as well. And I think that there are very human reasons for doing that, but we haven't benefited as much as we could. And we need to have very rigorous, very independent, objective evaluations done of work on adolescent girls by third parties that have nothing to gain or lose from being highly critical in a constructive way, but who can say things simply are not working, and we have to be willing to find out what is failing and to be very public about that, because that's the only way this is going to move forward. There's a lot of discussion now about randomized control trials, and certainly the work from Zomba on the conditional cash transfers has kind of heightened interest and kind of awareness around what the benefits of doing RCTs is. I'm not an RCT expert, but I'm certainly persuaded by a lot of what I hear about what they can teach us. Whether or not that an RCT is appropriate for every program on adolescent girls is an important question to ask. But the features that make it rigorous, the more that we can adapt that into the programming and evaluation we do, I think, the better. And then if we're going to be doing programs with a large population or a larger population and one that is testing various interventions, it's absolutely important to identify what the benefits are of each arm of an intervention, and I think also do a costing analysis. And this is something that's been absent from a lot of our work as well, which makes replicability very difficult.
Yes, indeed. And I think an extra thing is that you need to monitor or evaluate many outcomes with something so central and so structural as women's agency. It has an effect on lots of things, and it's often difficult to measure everything. Any more questions? Freda said, it's not so much that there are no questions as there are many questions. I personally need to see the charts again in order to make take in the entire program. Okay. To what extent, here there is one from Nambusi. Maggie, can you see the question? I'll just read it out for now.
No, I can't see it, so if you could read it.
Okay, thank you, Maggie, for a really rich and interesting question. You mentioned that the key to program success will be ensuring local government buy-in. To what extent do you think that core social services and government agencies recognize the need to improve girls' agency, and what would you think the key challenges will be in doing so?
Yeah. I think that's a great question. Presumably, I would assume that one core group we're talking about then in that case would be like health workers, and whether or not they buy into the idea of girls' agency and see that as being a core piece of the work that they do in delivery of social services. Am I understanding the question correctly?
Let's see whether Nambusi, can you unmute yourself and perhaps ask for clarifications if it isn't so? Yes, exactly. Health education rights, etc. Yes.
Yeah. So I think it's a great question, and I'd like to hear from people who are on this call what their experience has been engaging with local health care providers or teachers or social development officers or social welfare officers or whomever to try and mobilize greater attention towards girls' needs and girls' rights. I think that I haven't seen much attention to this yet, and when I have seen it, it has basically been in the context of a donor-driven mandate, that, we're going to fund X family planning provider to do a particular program targeting adolescents, or, we're going to expand our PMTCT, PEPFAR-funded work. I'm making this up, but I can imagine it happens, to try and get young mothers who may be adolescent girls. I haven't seen it coming from governments themselves, but I think that's precisely the kind of thing we need to be doing to get local government authorities more engaged in this issue. So I'd like to put the question back to the group and say, does anybody have experience in this particular area of getting local government service providers to take on adolescent girls as an issue that they are trying to do something about?
Okay, so I have got Asta Ramaya, who raises a hand. Is that to say that you want to comment on this or suggest your experience on the field? Asta? Unmute yourself. Okay, so I had a hand raised, but there is no reply. So let me just take a question here that Juliet Coleman has asked. Have you considered what impact religion has on girls' agency? That's Juliet's question.
It's a great question. Obviously, I haven't considered it enough because it doesn't feature in here, except nominally would come under norms, but it is extremely important, and I thank you for pointing that out. And can I ask in return if you've done work on religion and how that features into programming for girls? And if so, can you share, or can anybody else share experiences?
Let's see whether we can hear from Asta, because
hello.
Hello.
Hi.
Go ahead.
Okay, perfect. So I have done work in Twara with Maggie. So I just wanted to say I think it's very much in addition to the funding, I think it's also based on what the current situation is in that area. So if people are aware that the adolescent pregnancy rate or teenage pregnancy rate is high, they are more likely to address it within schools than not. And I know that especially in Twara, within the schools I have worked at, we have tried to, one of the programs we've implemented includes like community outreach to theater, and we have clinical officers who are in Twara who have been going to the different schools and giving peer education to the students regarding sexual and reproductive health. We've also been trying to connect children to the facilities and talking to facilities as well to try and create a safe space for adolescents to come and access contraceptives and family planning services. Tendency is, like in most places of Tanzania, it's not as vigilant, and it's very much funding driven. But I think if the government does play a role, and there has been an increase in the number of articles that have been coming up within the newspaper, at least when I was there. So I think people are getting more and more aware that there is this problem and it does need to be addressed, but it's not being done collectively. And I think that's what when Maggie said the Patchy projects, I think that is what she was talking about. As for the religion and girl programming, I'm writing my PhD applications, and that is what I want to look at, like in terms of what role does religion and culture have on contraceptive use, and what role it has within girl programming. Again, I think there is, in different parts of Tanzania, because there are so many different populations and subpopulations we're looking at, I think it's very hard to just say, like Christianity makes a difference in terms of accessing contraceptives or something. I think it's more to do with peers, like what your social networks are, who you're interacting with, how you've taken in the topic that you've learned about, and it's a mixture of all these structural drivers which play a role in terms of whether you go to that clinic and pick up a condom or not, or if you go to a clinic and pick up a OCP because you feel you have that will to do it.
Right.
Okay.
Right.
Maggie, do you want to respond to that? Because I've got three.
No, I think that was very clear. Thanks, Asha. Thanks. I think if there are other people who want to contribute to that question or others, I would be very interested. And again, I'm particularly interested in hearing people's experiences of programming with local governments. I think we can think of really great NGO-driven programs, and then they come and go in a couple of years, and they, fade away when the donor leaves and the NGO leaves. And as difficult as it is to work with local governments, I think we've got to figure out ways to do it for keeping the work going in the long run. So if anybody has experience with that, or if you want to share it offline, so to speak, in an email to me, I'd appreciate it. Or if people have ideas now, they can put on the phone call.
Okay. Well, we have three people in line to ask a question. So that's Mia Sule, and Christine Michaels, and Katie Gannett. So Mia Sule, I don't know whether I pronounce your name correctly, but could you unmute yourself and ask your question? I don't know whether it's working.
Hello, this is Mwanda.
Hey?
Yes. Recently made a visit to Zanzibar, and they have a program that is supported through supporting government through Save the Children and UNICEF. They started a one-stop center for reporting of violence, and they've looked at the data, and over 1,400 cases of violence have been reported in the last year. And they've used that information to bring to government and to have buy-in from the government with regard to the issue. And now they are launching a significant communication strategy to address social norms. One of the things that SAVE has also done is train kids themselves in facilitation skills and allow the children to run a workshop where they came up with solving their own issues. But at this point, government really has the buy-in, and one of the things that's most impressive is that many of the public workers from police and health are taking on the new responsibilities without top-ups. I guess coming from a PEPFAR background, that's quite impressive. So the government political will is there, and potentially through showing the data with regard to prevalence, they are starting, there's a very large community discussion with regard to the issue. So the big move is that people are talking about it. So that was one of the ways that and they're involving kids in solving their problems.
Thank you. That was very helpful, and I need to talk to colleagues here more about that. And my guess is that it also comes out of this research on the violence against children research and kind of some of this work around the child protection teams as well. And I think it's a very, very interesting model to see how much it can and how to address girls. The challenge is, the benefit is that it is completely integrated within the existing local government structures in terms of the police and everybody else. And then, as you're saying, because Save the Children, it's a UNICEF kind of driven thing, and with Save the Children, there's a big engagement with the children themselves and young people themselves, which is extremely important. I think it's going to be interesting to see how the least funded and kind of least recognized government civil servants act and carry forward this agenda, because relying on kind of social workers and community development officers is very challenging. And then on the other hand, you have people like police and criminal justice who, often are the perpetrators of violence against children. So I think it's a very promising model. It's going to be a very interesting one to see how it unfolds towards the benefit of girls, given the people who are inherently implementing it. But I think it's going to be a very useful thing to measure in Tanzania and to share globally.
Okay. Maggie, there's two remaining questions, and I'm going to read them out to you both at the same time here because we're nearly at the end. So, everyone loves your presentation, and that's always the first sentence they said. So here Christine asked, you mentioned that this effort is led by TAC-AIDS. Clearly, such a comprehensive program would produce several benefits beyond the HIV sector. To what extent are other sectors or line ministries involved in these efforts at the national and district level? Now, that's question one. And Katie Gannett is asking. She's from Grassroots Soccer, and they're running HIV prevention programs, one of which is specifically focused on girls. Our programs tend to focus on children in school, and she would like to hear more about how exactly the program targets girls that are not in school. How do you identify these vulnerable girls?
Yeah. Great questions. So the first question about other sectors beyond TAC-AIDS, the National AIDS Commission is driving this. So there's good news and bad news about that in terms of getting sectoral buy-in. The good news is, and the reason that this all happened is because of the person who happens to lead the Tanzania AIDS Commission, which is the national umbrella body, who is a woman, doctor, by the name of Dr. Fatma Mrisho, and she has been on the forefront of adolescent issues for decades in Tanzania. And so because of who she is, this is taking on a kind of possibly, if we're lucky, a national visibility above and beyond what it might ordinarily get. And because it's the national AIDS coordinating body, it is the multi-sectoral coordination arm of the government for AIDS. So it's HIV/AIDS. It's supposed to involve every ministry, every private sector, public sector, everybody. So in the best case scenario, between having Fatma in the lead and what the agency is supposed to do, we're going to get broad application. The downside is, as with any national commission working on anything, it's extraordinarily diffuse and hard to track and monitor, and who knows how much depth and resonance they're really getting in their programs. So some of that remains to be seen, but in theory, it's supposed to be multi-sectoral. On the question of out-of-school girls, I don't have a very clear answer to that yet. We're trying to figure it out. And, again, I would really love to hear from people who have done it about the successful and unsuccessful strategies that you've had for identifying out-of-school girls. I think that it, by nature, requires a much more community-driven approach, and because you can't rely on walking into a school and finding them there. They're not a captive audience, and so you have to have a much more community-based approach, which can also become very touchy-feely and kind of unregulated, I think. But with some of the programs, including the Biru Tesla in Ethiopia that I pointed out, they have worked with local government. Now, of course, that's easier to do in a place like Ethiopia than in a country where government isn't as active and directive. But they have worked with local government authorities, and very importantly, they have young female mentors. So these mentors who are, I think they're like maybe 20 to 25, maybe 25 to 30-year-olds, who serve as a key intermediary between the very vulnerable girls who are not in school and the program, and they go door to door in those communities finding these girls. And as I said, in the case of Ethiopia and in many other places, many of these girls are domestic workers and extremely isolated and vulnerable. So I think that's a mechanism to use as well. But can I just say, in response to that question and in closing, because we've reached the end of our time, I personally would really value and welcome and appreciate a kind, engagement with people who participated in this call further. Please email me, and I want to hear from your experiences. And you can just reach me at my last name, Bangser, @gmail.com, or through Stride. They can put you in touch with me, and I hope we can keep this conversation going.
So it says, how does an NGO approach the area? How does the NGO approach the area of teacher violence, given the difference in authority?
Great question.
So I don't know whether that's an easy one to answer in just a minute.
I don't think so. It's a really great question, and I think it's something that deserves a lot of thought. And if people have experience, I think that we can work on it. But I will say that I think, just like health workers are often lumped together and given a very bad rap, very bad reputation, that can also happen with teachers also. And there really are a lot of remarkable teachers doing extraordinary work under very difficult circumstances. And I think we need to reach out to them and also to work with teachers' unions, which, talking about platforms of people working at scale nationally, teachers are everywhere. And if you can work through a teachers' union to try and do work around reducing violence in the classroom, I think that might be an interesting strategy, but that's very much off the cuff, and I think it deserves a lot more thought. It's a great question.